maybe switch a little bit here. Of course, the main theme of the podcast is, how these new technologies are impacting jobs. So in the work that you've been doing, I would assume that doctors and nurses are the ones that are going to have their jobs changed the most. Have you experienced, or what kind of experiences have you seen for some of these professionals in healthcare, specifically when dealing with patients that are dealing with pain and when they use VR?
Well, I think the immediate change for, say, nurses. So you look at nurses do the bulk of care.
Yeah.
Doctors come in, they see you in the hospital, they walk out, and the nurses do most of the stuff. So if burn nurses are amazing people. You have to be a special kind of human to be a burn nurse to begin with, because it's so intense and people get belligerent and angry. And I mean, it's terrible. So number one, if you can reduce the stress and you can speed the process and reduce the need for opioids, all of these things point in a great direction for reducing the anxiety and the stress for the workforce. For doctors really are looking for new tools in their toolbox. They know that opioids are not a great solution. They see that on a daily basis, but in a way they're stuck. So it gives them a new thing that they can offer to replace the drugs. So a different level of change for the workforce, it pertains, I think, to doctors and healthcare and teachers and other things. I think when therapy, mental health therapy. I think that we all want to be independent. We all, I want to be an independent learner. I want to be independently healthy. And I want to rely on the healthcare system as little as possible. So using digital approaches like VR can enable me to be my own learner, my own, I won't say my own doctor, but it can empower me to do a lot more on my own.
Right.
So what does that mean for the health system or the education system? What that means is that in some cases, we'll be able to embody different kinds of therapy and send them home with the patient. Or different kinds of education, and that can happen in lots of different contexts and not just in a school. So it can happen at home, it can happen in the workplace. Workplace training is already changing as a result of these kinds of technologies. So and then you can use things like heads-up displays and headsets, give people just-in-time information. So the kind of information that they're going to need, the kind of skills that they're going to have, is going to gradually shift from that sort of facts and sort of knowledge to higher meta approaches, like understanding how to solve problems and do things like that. So that's kind of a big soup of things, but to sort of break that down and make it clearer, number one, we're going to have people more functional on their own as functional learners or functional, I don't want to call them patients, but, in the health realm. So VR is going to make that change. And when you make that change, I don't think it replaces a teacher. I don't think it replaces a doctor. And it certainly doesn't replace a nurse. We need help. We need, but it makes, teachers spend so much time just doing the rote stuff. And so in graduate school, I created a thing, it's called Zengo Saiyu. It was an environment to teach Japanese. And that was my own personal research. And I created the world's first virtual reality language teaching approach. It's a game and it's kind of thing. language learning is kind of the epitome of the in the beginning, the teacher is mostly a tape recorder, right?
Right.
Da, 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 da. They repeat it over and over. If you can take away that drudgery and offload that to a machine, then the teacher can be doing a lot more interesting things. That's just one case, but I think that applies to education in general. Their role changes.
Yeah.
So it's not that they disappear, but they can do a lot more interesting things. Like, people would rather be working with higher concepts than just teaching the rote facts. If we can learn the rote facts or get a feeling of the concepts through direct manipulation, then the teachers, a professor, a teacher can really engage with the more complex and interesting ideas. Same thing in healthcare, but that's basically where I see the biggest change potential.
Perfect. No, that's great. That's also one of the main trends that I see in many of the podcast discussions that I've had in numerous other industries. Right, it's not always that the job will be automated or destroyed or canceled. Is that the role of the employee will change, no matter what employee that we're talking about, with these new kind of technologies coming in, and enables more kind of human to human interaction. That's, as you said, maybe more at a higher cognitive level, but also just more enjoyable for either the student and the teacher, or the nurse and the patient, or whoever we're talking about in these roles.